Hi, Ms. Rodriguez. My name's Eva, and I'm gonna be your nurse practitioner today, okay?
Okay.
Today I'm gonna be doing a head-to-toe assessment on you.
Okay.
So I'm gonna go ahead and start with your head, okay? Have you noticed any dryness to your scalp? No, any dandruff?
No.
Okay, go ahead and look forward. I'm gonna take a look in your scalp. Perfect, there's no dryness noted. I'm gonna palpate your scalp, okay? Tell me if anything hurts.
No.
No? Okay, perfect. So there's no masses. The scalp is symmetrical. Your face is symmetrical. I'm gonna ask you to do a couple of things, okay? Go ahead and raise your eyebrows. Puff up your cheeks. Smile, give me a big smile and show me your teeth. Perfect. And then, okay, so your cranial nerve number 7 is intact, okay? Okay, there's no imperfections in the skin and the face. Okay, now I'm gonna take a look at your hair, okay?
Okay.
Okay, so hair is smooth in texture. Perfect. Now I'm gonna go ahead and take a look at your trachea, okay? Go ahead and just look up slightly. Perfect. The trachea is midline. I'm gonna go ahead and palpate your thyroid gland from the back, okay? Sorry. Okay, go ahead and swallow. Okay. The thyroid gland rises upon swallowing, and there are no nodules felt upon popping. Okay, now I'm gonna go ahead and listen to your breath sounds through your trachea, okay? Perfect, there's normal air exchange in your trachea, okay? Now I'm gonna go ahead and feel for your lymph nodes to see if they're swollen. You tell me if you feel any pain, okay? Okay, so these are the preauricular, post-auricular, let me see, your tonsils. There's no swelling to your tonsils. Now I'm gonna try and feel for the deep cervical, okay? Perfect. Shrug your shoulders for me. I'm gonna try and palpate for your supraclavicular lymph node. Perfect, and now this side. Okay, there's no lymph node adenopathy. Okay, we're gonna go ahead and move on to the eye assessment, okay?
Okay.
Alright, so I'm gonna take a look at your eyelashes and your eyebrows. So they both appear to be full. There's no lesions noted. There's no edema to the eyelids, either top or bottom. I'm gonna go ahead and pull your eyes down a little bit, okay? So that I can see the conjunctiva. Perfect, it's nice and pink and moist. Perfect, the sclera is white. And there's no abnormalities noted to your pupil or your lens, okay? Alright, I'm gonna go ahead and check for eye alignment, okay? I'm just gonna flash this light right in the middle. Just keep looking straight at me. Perfect. The light falls equally in both eyes, so the eyes are aligned. Now I'm gonna go ahead and take a look at your retina, okay? This light's gonna be very bright. I'm sorry, it's gonna be very uncomfortable.
Okay.
Go ahead and keep your eye open. I'm gonna get close to you. Perfect, so the retina is yellow. The vessels are small and the disc is sharp, okay? Now we're gonna look at this eye. I'm sorry. Perfect. Same thing with this one, okay? They're both equally bilaterally. Okay, now we're gonna go ahead and move on to the ears, okay? Alright, so I'm just gonna inspect both ears, making sure there's no lesions. There's no pain in your ears, the outside, nothing. Okay. The earlobes have no lesions or no masses, okay? I'm gonna go ahead and take a look inside your ear. Is that okay with you? Perfect. Alrighty. Sorry. Perfect, so the ear canal is clear. There's no earwax, no foreign objects. The tympanic membrane is gray, okay? And there's no perforations noted. Okay. Now this ear, let's see. Perfect, same thing with this ear, okay? There's no wax noted and the tympanic membrane is gray and intact. Okay, go ahead and move on to the nose portion of the assessment, okay? Alright, so I'm gonna go ahead and take a look inside your nose.
Okay.
Go ahead and look up a little bit. Perfect, there is no septal deviation. There's no discharge, no redness noted. We're gonna go ahead and check your sinuses, okay? And there were no polyps either, okay? Just so you know. Tell me if it hurts, okay?
Okay.
No pain, no tenderness?
No.
Perfect, now here? No?
No.
Perfect, so the maxillary and the frontal sinuses are clear, okay? There's no tenderness noted. Okay, now I'm gonna go ahead and assess your mouth, okay? All right, so right from the get-go, I see that your lips are not dry, they're moist. There's no cracks in them. I'm gonna go ahead and look at your mouth, okay? Go ahead and open up big, stick out your tongue, lift your tongue up for me, and then go ahead and smile big for me. Perfect, okay? So either the gums, the oral mucosa, they are all moist and pink. Your hard and soft palate, there's no lesions noted, okay? And then your teeth, there's no discoloration or there's no missing teeth. Okay. Now we're gonna go ahead and move on to the neuro part of our assessment, okay? So I'm gonna ask you a couple of different questions. So first of all, what is your full name?
Ana Rodriguez.
Perfect. And do you know what kind of building we're in right now?
A hospital.
Perfect. And what year were you born?
1992.
Great. So the patient is alert and oriented to person, place, and time. So what's 2 plus 2?
4.
Great. So patient is able to calculate. What does a lake and an ocean have in common?
Their bodies of water.
Perfect. So abstract thinking is intact. And what high school did you go to?
Del Valle.
And do you remember my name from the beginning of the assessment?
Yes, Eva.
Perfect. So short and long-term memory are intact. Okay, now we're gonna go ahead and test some of your cranial nerves, okay?
Okay.
So first we're gonna test your sense of smell. So go ahead and close your eyes for me. And tell me what you smell.
Coffee.
Perfect. So cranial nerve 1 is intact. Go ahead and dangle your feet. That way we're gonna see your eyes, okay?
Okay.
Alright, so tell me when you stop seeing my fingers, okay?
Stop.
Okay, perfect. Now I'm gonna ask you to follow my finger. Perfect. And in. Perfect. Now I'm gonna go ahead and look at your eyes. Okay, so just look straight at me. Awesome. Okay, so pupils are perla. So cranial nerves 2, 3, 4, and 6 are intact. Okay. Now go ahead and open your mouth big. Stick out your tongue. Move it side to side. Perfect. And say ah. Perfect. So cranial nerves 9 and 10 are intact. Go ahead and shrug your shoulders. Perfect. So there's no muscle twitching. There's a 5+ strength in your shoulders. So cranial nerve 11 is intact. Okay. Close your eyes and then you tell me if you feel sharp or soft in your face. Okay.
Okay.
So let me show you. This is soft.
Okay.
And then this is gonna be sharp, okay?
Okay.
Okay, go ahead and close your eyes. Tell me what you feel.
Soft.
Okay.
Soft. Sharp.
Perfect.
Soft. Sharp.
Okay, perfect. So cranial nerve number 5 is intact, okay? Now I'm gonna do a whisper test to see if your hearing cranial nerve is intact, okay? All right.
A, B, C. Y, W, X.
Perfect. So your hearing is good, okay? Now I'm gonna go ahead and test your muscle tone, okay?
Okay.
Okay, so go ahead and pull your arms like that. Don't let me pull, don't let me push. Perfect. Now go ahead and stick out your hands. And then go ahead and press on my fingers. Perfect. They're strong. Like now put your fingers like that. Don't let me close them. Now don't let me open them. Perfect. Now your knees. Go ahead. The same good pressure against my. Perfect. Now we can. There you go. Go ahead. So that's good. There's good muscle bulk and tone. Okay, 5+ throughout. Go ahead and put your hands out for me. Close your eyes and you tell me your fingers. We're gonna spread them out a little bit. If I'm pulling them up or down. Okay.
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 Up. Down. Up. Down.
Perfect. And then go ahead and put your palms up. Close your eyes and tell me what I put in your hand, okay? Go ahead and feel it.
A key.
Perfect.
A key.
Perfect. So your sensory is intact. Rodriguez, now I'm going to go ahead and ask you to stand up. You're going to close your eyes. We're going to perform the Rollberg test, okay? Close your eyes and then just go ahead and stand there, okay? For 20 seconds. Okay, you can open your eyes now. There was just normal swaying, okay? Now I'm going to ask you to just walk normal, a few steps. Now walk back. Perfect. Just G has a steady gait. Now go ahead and walk on your tippy toes. and back with your heels. Perfect. And then do me a favor, go ahead and walk straight, heel to toe, in this little line, okay? Perfect. And the patient has good balance. Okay, you can go ahead and take a seat again. Now I'm gonna ask you to touch your finger to my finger and then to your nose, okay? Go ahead, and then nose. Perfect. Okay, now with your other hand. Perfect, now go ahead and lay all the way down for me. Now you're gonna run your shin down your heel down your shin, okay? First on this side. Perfect, now on this one. Great. And then now we're gonna check your hand movement, okay? So go ahead and put your hands up and then put them on your lap and do it quick. Perfect, there's good hand coordination, okay? Okay, now we're gonna test your reflexes, your descended reflexes. Go ahead and sit up for me again. Perfect. Okay, so first we're gonna do the bicep. Okay, let me try this again. Okay, perfect. Now this side. Just you can relax. Perfect. Now. Okay, good. The tendon reflexes of our two class. Perfect. Now this one. Perfect. Okay. I have two more, okay? Perfect. Perfect. And then the last one's the Achilles tendon, okay? Alright. Perfect. All your reflexes are 2+, okay? Okay, now we're gonna elicit some reflexes on your stomach and your feet, okay? Okay. So let me start with your feet first. Okay, perfect. Perfect. So the reflexes are present, okay? And then the last one's in your stomach. Okay, perfect. And then I'm gonna try back here real quick. And then, okay, sounds good. All your reflexes are present, okay? Take a look at your respirations, okay? Okay. Well, I can see the patient's taking 17 breaths per minute. They're even and unlabored. Let's go ahead and take a deep breath. Perfect. There's no muscle retractions noted. Your chest is symmetrical and the chest is normal in shape, okay? Also, the respirations, there's no lagging movements in the respirations. And let's go ahead and palpate your chest, okay? First, I'm gonna do the front, and then I'm gonna move to the back.
Okay.
Tell me if you feel any pain.
No.
No? How about here?
No.
No? Perfect, so there's no masses noted to your chest.
Okay.
I'm gonna put my palms on your chest, and then you're gonna say 99, okay?
Okay. 99. 99.
Perfect, there's expected fremitus noted. I'm going to be giving you little taps on your chest, okay?
Okay.
All right, so I'm gonna cover you a little bit. Okay. And can you open your arm a little? Perfect, all areas are resonant, okay? No dullness noted.
Okay.
Now I'm gonna go ahead and listen to your lung sounds, okay?
Okay.
Perfect, go ahead and take a deep breath. Perfect. And last one. Perfect, all areas are normal, clear lung sounds, and no adventitious lung sounds heard, okay?
Okay.
All right, now I'm gonna ask you to say number 99, okay? Just 99 when I put my stethoscope on you, okay?
Okay. 99. 99. 99. 99. 99. 99.
Perfect, so no bronchophony noted, okay?
Okay.
Now I'm gonna go ahead and go to the back.
Okay.
All right, I'm gonna do the same, just go ahead and touch it to see if you don't have any masses, no pain anywhere.
No.
Perfect, there was no masses noted. I'm gonna put my hands and you take a deep breath, okay? Perfect. So chest expansion is normal bilaterally. I'm gonna go ahead and do the same little taps in the back, okay? So I'm gonna uncover you a little bit. Perfect, that's good. All right, you're gonna feel little taps, okay?
Okay.
No tenderness nowhere.
No.
Perfect, so no areas of dullness either, and all areas are resonant, okay? Now I'm gonna go ahead and listen to your lung sounds.
Okay.
Take a deep breath when you feel my stethoscope, okay?
Okay.
Okay, so all lung fields are clear and there are no adventitious lung sounds. Now I'm gonna put my stethoscope again and you'll just say 99, okay?
Okay. 99. 99. 99. 99. 99. 99. 99. 99.
Perfect.
Okay,
There's Ms. Rodriguez. Now we're gonna move on to your heart assessment, okay?
Okay.
All right, go ahead and lay all the way down for me, please. We're gonna take your pulse and your blood pressure, okay?
Okay.
Let me see your arm. Lift it for me. Okay, put it down, one more. And then your finger. Perfect. I'm just gonna feel for your pulse real quick. Perfect. It's strong and 2+, okay? While that's being taken, I'm gonna check for your jugular venous pressure, okay? I'm gonna put the bed at 30 degrees. All right. Now go ahead and look that way a little bit. I'm gonna cover you a little. Perfect. Okay. Perfect. Perfect. So your jugular venous pressure is at 2 centimeters above the sternal angle, okay? Now I'm gonna go ahead and listen to your carotid arteries, okay?
Okay.
Perfect. You don't have to move, okay? You can just stay like that. Now the other side. Perfect. No bruise noted bilaterally, okay?
Okay.
Now I'm gonna go ahead and touch both of them, okay? One at a time. Perfect. Now the other one. And while I'm here, I'm gonna test for the carotid upstroke, okay? I'm just gonna go a little higher. Perfect. So the carotid upstroke was brisk, the amplitude was normal. There was no thrill felt over neither one of the carotids, and the pulse was strong, 2+ bilaterally, okay? Okay, now we're gonna go ahead and take a look at your chest to see if I see some precordial movements, okay? I'm gonna lay you flat. It makes it easier for me to identify, okay?
Okay.
Perfect. I'm gonna uncover you. You're gonna feel my hand, okay? It's a little bit cold.
Okay.
Go ahead and take a deep breath for me. Another one. Perfect. I feel no heaves or thrills, okay? Now I'm gonna ask you to turn at about 40 degrees and go that way, okay? We're gonna try and feel for your apical pulse, Ms. Rodriguez.
Okay.
Like 40 degrees. Yeah, that sounds about right. I can help you with my hand, okay?
Okay.
I'm gonna put my hand one more time right here. Perfect, I can feel it. It's about 3 centimeters in diameter. I found it at the mid-clavicular line, 5th intercostal space. The pulse is strong. It's brisk and tapping, okay?
Okay.
Perfect. Looking for the systolic impulse, okay? So I'm gonna lay you down a little bit more flat. I'm gonna be putting a lot of pressure in your between your rib cage, okay? We're gonna be checking for the systolic impulse. First, we're gonna check for the right ventricular one.
Okay.
All right. I'm gonna cover you a little bit. I'm gonna look for the third, fourth, and fifth intercostal space, okay?
Okay.
Okay. So then you're gonna feel my fingers. Go ahead and exhale all your air, and you're gonna hold it there until I tell you, okay? And hold it. Okay, you can let it go. Perfect. There was no impulse felt there, okay? Now we're gonna feel for the pulmonary artery systolic impulse. That's gonna be the second left intercostal space, okay? Go ahead and do the same. Exhale and hold. Perfect. You can breathe now. No impulse felt there. And the last one's the aortic outflow tract. That one's in the right second intercostal space, okay? Do the same. Perfect. No impulse felt there as well. I'm gonna sit you back up a little bit, and then we're gonna listen to your heart sounds, and that will be the end of our assessment, okay?
Okay.
Perfect. First, I'm gonna listen to your second right intercostal space. Now the second left intercostal space. The third intercostal space. The fourth intercostal space. The fifth intercostal space. And the last one's the apical one. Perfect. So S1 and S2 are heard. There is a split in S2 in the second and third left intercostal space, which goes away upon exhalation. And there were no murmurs heard, either systolic or diastolic, okay? I'm just gonna check for 2 more murmurs, and then we are done.
Okay.
So go ahead and turn again to your left at a 40-degree angle. And I'm gonna listen with the bell, okay?
Okay.
Okay, perfect. Now you're gonna go ahead and sit up, looking towards me. And then you're gonna lean forward a little bit, okay? Perfect. Go ahead and move on to the abdomen assessment, okay? It's gonna include the liver, the spleen, and the kidneys.
Okay.
So first of all, I'm gonna inspect your abdomen, okay?
Okay.
I'm gonna uncover you a little bit. And then let me see. Go ahead. Okay, perfect. Okay, so right off the bat, I can see that there's no discoloration in your abdomen. There's no abdomen scars. There's no, the skin is warm and dry. There's no stretch marks, nothing like that, okay? There's no distension, and the abdomen is flat.
Okay.
Now I'm gonna go ahead and get an eye level to see if there's any pulsation, okay?
Okay.
Perfect, I don't see any pulsation. I'm gonna go ahead and listen to your abdominal sounds, okay?
Okay.
Perfect, I'm gonna start in the right lower quadrant. And then I'm just gonna listen to your aorta, okay? Perfect, so there's no bruise over the aorta. And the abdomen sounds, they're normal active and they're gurgling in nature, okay? Now I'm gonna go ahead and percuss, which means I'm just gonna be tapping over your stomach. And then I'm gonna be estimating the size of your spleen and your liver, okay?
Okay.
All right, I'm gonna raise it up a little bit more. Okay, perfect. You tell me if it hurts, okay? If anything hurts. No, no pain. Perfect, so the liver is dull and it's about 7 centimeters wide in the mid-clavicular line.
Okay.
Now I'm gonna go ahead and percuss the spleen, okay?
Okay.
Sorry. I went ahead and found your spleen in the mid-axillary line between the 9th and 11th rib, okay? And it's about 5 centimeters wide.
Okay.
Now I'm gonna go ahead and palpate lightly your stomach, okay? You tell me if it hurts. I'm sorry, my hands are a little bit cold, okay?
Okay.
All right, sorry. I'm gonna go ahead and go here first. Any pain?
No.
Perfect. How about here?
No.
Here.
No.
And the last one right
No.
here. Perfect. So there are no palpable masses and no tenderness, okay?
Okay.
Now I'm gonna go ahead and go a little bit deeper, okay?
Mhm.
Any pain there?
No.
Right here on your right upper quadrant, I'm gonna try and feel for the edge of your liver, okay? I'm gonna
Okay.
go in a little bit deeper. I'm
Okay.
sorry. No pain there?
No.
Perfect. The liver was palpated 1 centimeter below the costal margin, and it's smooth, okay? The
Okay.
edge is smooth. Now here. No pain?
No.
Okay, now do me a favor, go ahead and turn that way a little bit so I can try and feel for your spleen. All right. No pain?
No.
Perfect, then the spleen cannot be felt, okay?
Okay.
Now if you do me one last favor, go ahead and sit up for me. I'm gonna check for CVA tenderness. You
Okay.
tell me if there's any pain, okay?
Okay.
Any pain there?
No.
And any pain there?
No.
Perfect, so there's no CVA tenderness. So first I'm gonna take a look at your shoulders, okay? I'm gonna go ahead and palpate your shoulders. Any pain there?
No.
Perfect, they are even. There's no atrophy in the shoulders, no fasciculations, and they're symmetrical, okay? Now go ahead and stand up for me because we're gonna be doing some exercises, okay? All right, so go ahead and lift your shoulders up and then back as far as possible. Perfect, now on your side, lift them and bring them back down. And then with one of your arms first, go ahead and touch your back. Now go ahead and touch your head. Oh, and then now do the opposite. Perfect, so there's full range of motion to your shoulders and the muscle bulk and tone is normal. Now we're gonna go ahead and inspect your elbows, okay? All right, so I can see there's no nodules, nor no swelling. The same, perfect, no nodules, no swelling. Now we're gonna go ahead and move your elbows, okay? So go ahead and bend your elbows and then don't let me pull them down, okay? Perfect. Now don't let me push them out, perfect. Now extend them out. Now go ahead and put your palms down and put the palms up. Perfect, so there's full range of motion to the elbows and the muscle bulk and tone are 5+. Okay, now we're gonna go ahead and take a look at your fingers, wrists, and hands, okay? All right, let me go ahead and take a look at your hands, perfect. Okay, there's no atrophy, no angulation on your hands, wrists, or fingers. Let me go ahead and take a look at your palms, perfect. There's no atrophy to the thenar or the hypothenar area of your palm. Now we're gonna go ahead and move your hands, okay? So go ahead and do this to your wrist, now up, perfect. Now go ahead and put them straight and then take them out, in, perfect. So there's full range of motion to your wrists. Now your fingers, go ahead and spread them out, put them back in. Now the thumb, okay? So go ahead and put it in, out, move it in circles, and go ahead and touch your pinky. Perfect, there's full range of motion to all your fingers, and the muscle bulk and tone is 5+. Okay, guys, now we're gonna go ahead and take a look at your neck and your spine, okay? So do me a favor, go ahead and stand up real quick for me. Perfect, and then I'm gonna take a look at your side. Perfect, there's no abnormal curvatures, okay, to your spine. All right, go ahead and take a seat for me, because I'm gonna take a look at your scapula in the back. Perfect, the shoulders are symmetrical, the iliac crest is symmetrical, and the gluteal folds are symmetrical, okay?
Okay.
All right, now we're gonna do some exercises with your neck.
Okay.
Let's go ahead and start. Go ahead and put your chin to your chest. Now look up. Now go back to the middle. Go rotate side to side, and then I'll put your ears to your shoulders. Perfect. So there's full range of motion to your neck, and the muscle bulk and tone is 5+. Okay. So now go ahead and bend up again. Now go ahead and bend forward as much as you can. Perfect. Now lean back. No back pain.
No.
Perfect. Now rotate from side to side. And then go down. Okay, like this. Perfect. No pain?
No.
Okay, so go ahead and sit down. There's the muscle bulk and tone is 5+, and there's full of range of motion to your spine. Okay, now we're gonna go ahead and take a look at your hips, okay? Go ahead and stand up for me and just stand normal. Perfect. So the feet are hips width apart. Go ahead and walk a little bit, a few steps for me. Okay, now back. Perfect. So the knee bends upon walking. Your stride is about 2.2 inches, and then your feet, the heel to heel, are 4 inches apart. Okay. Your legs are symmetrical. Perfect. Now go ahead and lay all the way down. We're gonna do some leg exercises. Okay. All right. I'm gonna lay you all the way down. Okay. Go ahead and bend this knee up to your chest. Perfect. Now down. Now this one. Perfect. Now, can you move a little bit, or actually, can you put Perfect. Okay, now the other one to that side, I'm sorry. Perfect. Okay, now you can come back to the middle a little bit. Now go ahead and lift this leg up. No, not that much, like this, and then bring it out. Now in. Perfect. Now bend your knee. Perfect. I'm gonna just bend it a little bit. Oh, perfect. Now go ahead and go down. Now the same one with this, okay? Go ahead and bring it out. Bring it back in. And then I'll bend it a little bit. Okay, perfect. There's full range of motion to your hips. And the muscle bulking tone is 5+. Now we're gonna go ahead and take a look at your knees, okay? Okay, I'm gonna palpate your patella. Perfect. There is no swelling to the patella. Your quadriceps are symmetrical bilaterally, and there's no atrophy to them, okay? Now go ahead and bend both knees to your chest and down. Perfect. So there's full range of motion to the knees and muscle bulking tone is 5+. Okay, Ms. Rodriguez, now we're gonna go ahead and look at your feet and your ankles, okay?
Okay.
All right, perfect. So they're both symmetrical. There's no calluses, no corns. There's no dry skin noted, okay? Now go ahead and point your